Hi everybody, here we are, Chapter 25, Pathology and Laboratory. In our textbook, it starts on page 652 and ends on 665. So while it's only 13 pages in our textbook, in our CPT book, it's nearly 100. Starts on page 479 and goes to 578. That's how many codes they are that you will have to consider. So this is a very complicated section. We're going to go through the slides very quickly, but I really want you to have your CPT book with you and open as you're going through these slides, because it will make your life easier when you can follow along. So there are 18 different learning objectives for this chapter, and these are all the subsections that are on the screen for the different types of pathology and laboratory. So each subsection, for example, organ and disease-oriented panels, so these would be like your diabetes panels, drug assay, therapeutic drug assays, evocative suppressive testing, consultations, urinalysis, molecular pathology, chemistry, hematology and coagulation, immunology, transfer medicine, microbiology, and anatomic pathology, cytopathology, cytogenic studies, surgical pathology, transcutaneous procedures, other procedures, and reproductive medicine procedures. Wow, we have a lot to learn. So in the pathology and laboratory, there's a lovely figure here that this is what you guys do, right? You're taking blood. So these codes are for the laboratory testing only. Remember that we will have a separate code to code for the specimen collection. Remember my story about our venous blood draws, our venipunctures, 36415, how United one year decided they weren't going to pay any of those. And so our joke was that we could just hold the tube up to our arm and the blood would jump from the arm into the tube, which of course it doesn't do. So you need to know that anytime you're doing any kind of a laboratory testing, you will probably be responsible for making sure your venous draw gets coded, and that you will correctly label your tubes to be processed depending on where you're going to be working. Okay, in your CPT book, I want you to go to page 479, and under these drug assays, which is just one of the sections, there is a whole table there. The table goes from 480 to 494. In that fourth column over in your CPT book are the commonly associated protein disease acronyms. For example, go down the column and find Alzheimer, and you can see where they're going to do blood tests for Alzheimer. And this will help make this a little more easier to understand. But again, it's a table that you're going to be using, so you want to make sure that you get familiar with it. Okay? There's facility indicators that allow additional tests without the physician's written order. For example, urinalysis is positive for a bacteria. The built-in indicator is then to do a culture and sensitivity. Find out what exactly what kind of bacteria this is, and therefore what kind of antibiotic is going to work with it. There's a pathology laboratory caution. Usually you're going to report the second or subsequent tests without the modifier 51. If you have multiple procedures, you're going to report them with the times symbol. So the modifier 51 is not used with pathology and laboratory codes. You're going to code each one of them separately. There's different panels, and often there's tests that are grouped together that you will be ordering. For example, a basic metabolic panel. In this subsection, they're grouped together by the physician for the diagnosis or screening of various diseases or conditions. The groups of tests may be performed together depending on the situation. So an electrolyte panel, a general health panel. There's specific rules, however, about these panels. The first and foremost is you must remember that all the tests have to be conducted, and they must be medically necessary. Do not use the modifier 52 reduced if you don't do all the tests. If you don't do all the tests, you need to report each of those separately. Don't use a panel code. For example, if you have an OB, obstetrics panel, but you don't want to do the syphilis test, she had one 3 months ago, then you do not use the panel code. You break it all apart. The coding shot in your book is a really good example of this and some good information, being careful about coding multiple tests the same day on the same patient. For example, the Hep B test is both in the OB panel and in the acute hepatitis panel. So you want to make sure that you're paying attention to each one of those, and that's your responsibility as the person, the MA usually, who has been drawing the blood work. So you need to pay attention to those kinds of things, okay? Presumptive drug class screening uses codes 80305 through 07. It's divided by the method. So what method did you obtain this specimen to do this drug screening? There's optical observation. There is instrument assisted, and there's instrument chemical analysis. So it identifies the presence or the absence of the drug. This is qualitative, not quantitative. So this is qualitative. Is it there or is it not there? If the screening is performed visually, this is what it is, 80305. You're looking at it. Is the color, is there a color change, or is there cloudy, or is it clear? Those kinds of visual assessments. Presumptive drug class screenings. This is really demonstrated in your toolbox exercise 25.1. Chromatography, procedure in which single or multiple drugs are identified. So the screening is presumptive, and you're going to report it with 80307. So this can be a single or a multiple drug class per date of service, and this is how it's reported. It doesn't identify the amount of the drug present. Therapeutic drug assays, however, report both the presence and the amount, or the quantitative of or absence of a substance. The material can be examined from any source. Be sure to read the note in your CPT book 498 for all of the acronyms and identifications, and it's 655 in your textbook. All of the drugs here are listed by generic names. For example, amitriptyline generic name is for Elevale. So you need to make sure that you've got a PDR handy if you're coding drug assays. You want to make sure that you're coding exactly the right thing. It measures the peaks after a drug is given at intervals, and then troughs before the drug is given the next dose to monitor the therapeutic drug for medication adjustment. With all the opiate things that are going on, this is one way that we're testing to see, A, is the patient taking it, and is he taking it correctly, and is his body just metabolizing it too soon before before he has a chance for it to the next dose. He's using his medication because he's still in pain. So we need to make sure that we're very accurate with all of these codes, okay? Evocation and suppression testing. This measures the stimulating, the evocative, or the effect, calling forth a response, or suppressing agents. So it's the effect on the chemical constituents. For example, 80400, the patient undergoes testing to determine whether HCTHC is being produced. That's the adrenal gland. Is the patient suffering from adrenal gland insufficiency? So this test would be reported by reporting cortisol 82533 times 2, because you have to do again the before and the after. And there's a lot of component coding with this. So if we're only reporting the technical component, we're only doing that part of the testing, then that's the only thing you would code. There's additional services to report. Again, these are called components. We've talked about this before. So you need to be sure that you're billing for any supplies or drugs that are used in this testing. So the 99070 or a HCPCS J code, and if an evaluation and management code for the physician monitoring of the testing. So if the physician has prolonged attendance, if for example you're administering a drug by an infusion, and the physician has to stay there with the patient, you need to code that E&M code for this prolonged attendance. And we talked about that when we did E&M coding. Consultations, clinical pathology codes. This has to be at the request of a physician. Additional information about a specimen, and the consultant has to prepare, again, a written report. It's never a consultation if you don't have a written report. There are different levels of this consultation for clinical pathology. A limited one without reviewing the rest of the medical record, only talking about the specimen itself, or comprehensive with review of the medical record by the consultant. There's more consultation codes in surgical pathology section. But CMS, you need to be careful because CMS has very strict rules about bundling these. Often they will have you report 88329 for the initial pathology consultation during a surgery, and will bundle into that 88331 and 332 for the first and any subsequent frozen block. So you need to pay attention to those when you're coding them. The specimen is a sample of the tissue of the suspect area. Again, if it's a block, it's a frozen piece of specimen. A section is a slice of that frozen block. For example, the pathologist consults during the surgical procedure. He examines one block and then each additional. And again, as I said, CMS is now bundling most of these, so you have to be careful. Watch what payer you're talking about. Urinalysis is the most common test you're going to be doing. It's tests on the urine. So there's methods of testing. Of course, there's a dip, there's a tablet, reagent. The reason for the test, are we testing for pregnancy? What are we testing for? Sugars, whatever. The constituents are being tested for bilirubin, glucose. So you need to know why you're doing this test. So there's 6 things the coder needs to remember when he's coding a urinalysis. The identification of the specific test, whether the test is automated or non-automated, the number of the tests performed, the identification of the combination codes for similar types of tests, and whether the results are qualitative or quantitative, not whether it's there or not or how much of it is there, and the method of the test being used. All 6 of those things will go into you deciding which one of those tests off those 100 pages you want to use. Yeah, so the equipment, well, we just kind of talked about that in the remember of the 6 things. So it can be automated or non-automated, with or without a microscope. So again, you need to pay attention to those things, okay? All of those urinalysis subsections are under the 81,000 codes, 81,000 to 81,099. So there's 99 different tests here, and so that's why each one of those items of information are so very important. The chemistry subsection, 82,009 through 84,999. Look at that, 2,990 codes. Specific tests are on any bodily substance, urine, blood, breath, feces. Most chemistry tests are quantitative, specific amount, unless specified qualitative. So these codes are alphabetical in your CPT book, and so you need to remember what the difference is between qualitative and quantitative, and you can't stress that too many times. There's a huge difference, okay? All right, so chemistry, the samples come from different sources, and they can be taken at different times of the day and reported separately. So again, if you want to draw blood to check for a potassium level at 8 o'clock in the morning and at 2 o'clock in the afternoon, both of these tests would be billable because they, even though they're performed on the same day twice on the same patients, they were performed at different times of that day, and you would code that correctly. Okay, and then molecular pathology. So there's tier 1 and tier 2 sections for molecular pathology. And again, that's going to be your first thing that you need to pay attention to. Is this a tier 1 or is this a tier 2? For example, tier 1 is a more common gene-specific procedures. For that BRCA cancer gene, the breast cancer gene, 81211, BRCA1 or BRCA2. And then the codes 81400 and 81479 are tier 2 procedures. So these are for less commonly performed analysis. And 81479 is unlisted, and it's out of sequence in the book when you go looking for it. When a physician interpretation is required, remember that modifier 26. Attach that to the particular test that you're talking about. Hematology and coagulation. This is on page 660 in your textbook. This kind of looks like maybe an ATM machine or something. So it's quite an interesting looking little machine. This laboratory procedures are on blood. It can do a complete blood count or a white blood count. The codes are divided on the method of the blood draw and the test being conducted. So we want to make sure that we're looking for a particular factor, that we're addressing that if we're doing a coagulation. We're looking for very specific information, and so we have to code that very specifically. Immunology, identifying the immune system conditions caused by antibodies and antigens, for example, hepatitis C antibody screening. Also into this section comes tissue typing, the basic assay, the screening, and the typing. So we need to look for things like hypersensitivity, allergic reactions, immunity, alterations of body tissue. So again, very specific things that we're looking for. We want to make sure on tissue typing that we're looking for compatibility to match a donor to a recipient. So remember when we did integumentary, we talked all about, doing tissue transfers for burn patients. So it's not going to do our burn patient any good if we transfer tissue that is not compatible. So we need to measure and monitor the cytotoxic reactions. And then the next section is on transfusion medicine, codes 86850 to 86999. The blood bank uses these codes. This is in your book on page 661 to 662. So here's a patient obviously getting a transfusion. The blood bank codes talk about the tests that are performed in the blood or the blood products. Prior to the 1890s, when HIV became prevalent, nobody tested blood for that, and now of course they do. So this is just an example of one thing that's being performed. It does not identify the supply of the blood, but you're going to code based on the collection, the processing, and the typing. These tests include screening for antibodies, Combs testing, analgesic blood collection and processing, blood typing, compatibility testing, and preparation and treatment performed on the blood and the blood products. So remember, any kind of preparation, any kind of work that's going on with this prior to the transfusion is your responsibility to code. Microbiology, 87,000 series, is the entire subsection. So it's a story of microorganisms, identification of the organism, and the sensitivity of the organism to the antibiotics. Culture and sensitivity in your CPT book is on page 560, and that's where it starts, and you need to be really familiar with that. We talk about the study of microorganisms in bacteriology, mycology, parasitology, virology. And then bacteriology is the study of the bacteria. Mycology is the study of fungi. Parasitology, of course, is the parasites, and virology is the study of viruses. There's a microbiology caution here. Many code descriptions are very similar to those to immunology, so the difference is in the technique that's used. So culture codes need to be read carefully because some codes are used only to detect the presence of an organism, and others show the additional sensitivity and to determine which antibiotic would be used. So the difference is in the technique that is being used. Anatomic pathology, post-mortem examination. So these are known as autopsies. So anybody who watches NCIS knows that Ducky is the Doctor Who, the pathologist who handles all of the autopsies, or he used to, and now he's got an assistant. But you only report the physician's service. The codes are divided on the extent of the exam and the type of the exam. So gross versus gross and microscope. So a gross exam without the central nervous system is one code, and the gross and microscopic without central nervous code is another. You need to make sure that you're paying attention to those notes before you try to code those. Cytopathology is identify the cellular changes. A common laboratory procedure would be a pap smear. The codes are divided on the type of procedure and the technique used. And so this is something that you can identify with that section. Cytogenic studies also is the branch of genetics concerned with the cellular abnormalities and pathologic conditions. So for example, chromosomes. Why are we doing this testing? So we're trying to rule out the inheritance of a disorder. Surgical pathology, the evaluation of specimens to determine disease pathology. All tissue removed during procedures undergoes pathology evaluation. The operative report usually coded after the pathology report is received. Pathology reports are usually coded in the ER. Why the operation is in the OR, why the operation is going on. So if a patient had a chronic cough and the operative report was billed as chronic cough, but later the pathology report comes back as pneumococcal pneumonia, the cough was just a symptom, which is why you should always wait for the pathology report, because as we've learned in the past, you don't ever code the cough if you have a diagnosis that includes that cough. Okay? Surgical pathology, the unit of measure is based on the specimen. So an example here is 2 anus tags, each examined, 88304 times 2. Again, this is the way you're going to, the modifier you're going to use to identify that you're doing more than one. One anus tag examined in 2 different areas of the tag is just the 88304. So while there's 2 different tests being done, it's only on one specimen. So you're paying attention to the number of specimens. So a specimen is the tissue that is submitted for examination. Your types of pathologic examination. Microscopic is with a microscope, and gross is just looking at it without the microscope. And so you need to make sure that you're coding that. Microscopic examination are things that cannot be seen with the naked eye. So there, use your lovely little microscope. Okay? Okay, 6 levels of surgical pathology. Page 664 in your textbook. You want to be sure to read through those just to make sure that you're familiar with them, because that's very, very important. Okay, you can't assign the code without knowing the source of the specimen and the reason for the surgical evaluation. So why are we doing it? Are we looking for a cancer? Where are we looking at? The prostate, in the breast, in the lung? Where is it? The levels are divided on the complexity of the exam. So a good example is 88305 is the colon biopsy. 88307 is a colon, same place. However, this time we've done a segmental resection other than for the tumor. And then 88309 is the colon, a total resection. So see those different levels just right in there based on the complexity of the exam. So here are the levels. So level 1, a specimen can be diagnosed without microscopic examination. For example, the example that we usually use here is a tooth. You have a tooth. You can look at a tooth. You can see the tooth. You can see, you don't have to use a microscope. Level 2 is gross and microscopic examination is performed. Levels 3, 4, 5, and 6 include the gross and microscopic examination and additional physician work. So there's an increased difficulty. It's based upon the method of or need for removal, and the same anatomic site can be listed in each level. It just depends on the work that is being done by the physician. And all of your reports will say it's a level 1, level 3, level 4, level 5, or level 6 in your path report. Okay? Not included in these codes are additional service codes that are for a special stains that have to be done, or additional services are reported separately. Okay, there we have it. Conclusion, Chapter 25, Pathology and Laboratory. This is a very difficult section. It's very time-consuming because you have to read every single word in order to understand it and do it correctly. So good luck, everybody.